And we're here to make one thing absolutely clear. Di dapat mawala sa pagsasalin kung tukol sa alagang kulusugan. Or put another way, no deje que el cuidado médico se pierde en la traducción. For those of you who don't speak Tagalog or Spanish, that means don't let healthcare get lost in translation. California is the nation's leader in implementing healthcare reform. More than 825,000 Californians have secured affordable quality healthcare through California, and more than 1 million additional members of our community are now eligible for newly expanded Medi-Cal coverage. But our efforts are not limited simply to expanding the scope of coverage. We must also be focused on expanding the quality of care for every patient. We have some of the best doctors in the world working here in California, but the work they do becomes much more difficult, if not impossible, if the patients they're trying to treat can't understand a simple question like, where does it hurt? When a person is unable to communicate with their doctors, the best case scenario is that they end up undergoing unnecessary tests to arrive at the diagnosis. The worst case scenario is that the patient doesn't get the right diagnosis and ends up with the wrong treatment or no treatment at all. This is not an abstract issue for us. When more than 40% of Californians speak a language other than English at home, and when 7 million Californians have only limited proficiency in English. As a state, we have more than 200 languages spoken on a daily basis. It's clear that people who need health care are facing language barriers that place their lives and their health in jeopardy. I've introduced AB 2325 to ensure that patients have access to the medical interpreters they need to receive the right treatment for their ailments. Whether you speak Spanish, Cantonese, Mandarin, Korean, Tagalog, or Farsi, when you're speaking with your doctor, it's absolutely critical that your doctor is able to understand and accurately diagnose your condition. That's certainly true, especially in emergency room settings, where a chest pain can be a sign of something as innocuous as indigestion or as serious as a coronary. Where accurate information is critical and every second can make the difference between saving a life or losing one. But it's also true in diagnosing chronic conditions, whether a lump is just a lump or the most visible sign of a life-threatening cancer. And right now, for far too many Californians who don't speak English with fluency, that means that someone else, and often it's their children, must act as their interpreter. No parent should ever be forced to relay complex and often very personal information through their children because they're unable to speak the same language as their doctor. And no child should ever be forced to act as an interpreter when doctors are asking deeply personal but absolutely vital questions that children are neither equipped to understand nor should be expected to hear. We need to ensure that hospitals can deliver the best care possible to their patients, and that means we need qualified and trained interpreters on staff to ensure that patients can ensure doctors have the information they need and patients get the care that they deserve. AB 2325 is a smart investment in healthcare for California because the vast majority of funds available come from the federal government. In fact, we get a 3-to-1 federal drawdown for every dollar we spend here, meaning that we can strengthen our economy and improve healthcare outcomes without significantly impacting California's budget. This is a critical issue for a large and diverse state, and we will help ensure that no person's health care will be lost in translation.